All right. Good afternoon.
Good afternoon.
All right. Please state your name.
Dr. Melissa Clarke.
Dr. Melissa Clarke. It's a pleasure having you here. Uh, Tell me a little bit about your practice, what it's called, type of patients that you have, and your clinical approach to care.
Our practice is called Medical Home Development Group. We are a NCQA certified patient-centered medical home. We're located in Washington, D.C. We have 4 locations. So we're actually an independent physicians organization. So we're a group of physicians who've come together and have an overall similar philosophy, similar administrative and management back-end structure, but each retain their own individual practice. And as such, we're able to do programs across the practice in each of our 4 locations. We're fortunate enough to have locations in each quadrant of the city. And if you know anything about DC, you know that Ward 7 and 8, or east of the river, southeast, and some areas of southwest Washington, D.C., are medically underserved areas. And so we have 2 locations, one in southeast and one in southwest D.C. We have one in northeast D.C., which is in Ward 5, which is also medically underserved, and then one in northwest D.C., where we actually see a large number of individuals who are at a methadone clinic nearby, and we provide primary care for those individuals who oftentimes are excluded from the rest of the medical system because of their disease process and the rigors of the care that they have to undergo with the daily methadone treatments that they get. And so we're able to really be a stopgap within the medical system to provide care where it's needed most.
Okay. And what specifically is your role in the organization?
I'm the Vice President of Population Health and Provider Contracting.
Okay, great. Now, you have a very, I wouldn't say unique, but it is a fitting clinical approach to care. Can you talk about that a little bit?
Absolutely. We call it our whole person approach to care, which simply means that we try to take into account not just the individual's physical condition or physical diseases that they have, but also try to understand more about their mental health needs as well as the social determinants of health that can present barriers to them really being able to be their healthiest self. And as such, we do a assessment at the beginning of bringing them into care that takes into account their social needs as well as their mental health needs, and try to match them to the appropriate resources for care, some of which exist within our practice. So we have social workers, we have psychologists who can specifically address those domains of care. And also we refer individuals out if they need psychiatric care or other kinds of care to complement what they need. We, in addition, have a relationship with an organization called the Leadership Council for Healthy Communities, which is a 70-church consortium that is also designed to help meet the social needs of individuals. So they have food banks and food pantries and clothing banks, etc., to help bridge some of those gaps as well.
Wow, sounds like you have a comprehensive line of services, and it's very important to be able to address those social determinants and social needs. Now, you've been, I believe, working with the QIO, Delmarva Foundation, for about a year and a half now. Is that correct?
That's right, yes.
All right. And so can you talk a little bit more about that, and what capacity are you working with Delmarva, and just talk a little bit about that.
Sure. Well, we've had the good fortune to touch bases with Delmarva and have great working relationships in several areas. The first was working with Jennifer Thomas, helping to put together a model of medication therapy management with community-based physicians. And that's been very instrumental in trying to integrate it with one of our programs that is with the DC Healthcare Finance for Medicaid patients as well as our Medicare patients, where we provide care coordination And we also look for needs of people who are on multiple medications and have chronic diseases who require medication therapy management services. The next area was working with Janice Jones. Janet Jones. Really working on being able to provide a validated instrument to assess a program that we had put in place to help empower our patients when it comes to their own health and to navigating the healthcare system. So that was called the Be Health Empowered program. It's a health literacy program. And we were able to work with Janet to have the validated measure that was necessary to show that our patients had greater levels of activation before they went through the program versus after they went through the program. We're actually able to work with 60 individuals, some of who are our patients, some of who were not, who went through this program, and we were able to demonstrate that they were more activated, more engaged in their care, more knowledgeable about their care at the end of the program. And that was done at our Southeast location, which is actually on the first floor of a 700-unit apartment building that's subsidized housing in D.C. And then, of course, we also work very closely with Angela Diggs on the Diabetes Self-Management Program, which is also held in the same location. And we were able to refer individuals in our practice who had pre-diabetes or diabetes or obesity to the Diabetes Self-Management Education Program, which she taught a total of 6 sessions over the summer. And it was a great working relationship.
Thanks for sharing that. Staying with the diabetes, chronic disease management is a critical key element in DC. Specifically with your diabetic patients, what were some of the challenges that you wanted to overcome as a result of working with Angela in the diabetes self-management classes?
Right. So I would say there were 2 primary ones. One is, and I have to say, I wrote a book called Excuse Me, Doctor, I've Got What? Taking Ownership of Your Health and Making Healthcare Reform Work for You. And the purpose of the book was to address some of the issues that we see in some of our patients who feel overwhelmed when they get a diagnosis because they don't have the information, and oftentimes in the 15 minutes that the doctor has with that individual, there's only but so much time for education. So that's really the whole philosophy behind the patient-centered medical home model, is really being able to provide individuals the information and the engagement they need to be able to master the disease that they find themselves with. And so the Diabetes Self-Management Education Program then became an extension of what we really want to do, which is to empower people not just with information, but with actual tools to be able to effectively manage their disease. So that was one of the things that we were trying to address. The other is we concurrently ran a program with a organization in DC called DC Greens that provides vouchers for individuals that our doctors write prescriptions for, so that they can take the prescription to a farmer's market, and they cash it in for a voucher that they can use to buy fresh fruits and vegetables. And those individuals have to also have food insecurity, which we identify through our comprehensive assessment that I mentioned earlier. Part of the requirement for being in that program is that you're concurrently in classes to learn how to manage whatever condition you have that can be impacted by nutrition, proper nutrition. So several of the people that were in the diabetes self-management classes were concurrently in the Produce Plus program, and so they worked synergistically to be able to get people fresh fruits and vegetables, but at the same time get the information for how that fit into better self-management of their pre-diabetes, diabetes, or obesity.
Wow, that sounds like some great information, and that the program is success. I know as a diabetic myself that bridging the gap between my provider and having increased communication helps in being able to move the needle. Um, Thinking of one of your patients who was in the diabetes class, any success or anecdotal success stories that you can relay?
Yes, absolutely. So we have a husband and wife team who came to the diabetes self-management classes, and both of them highly rated the class. I think they made it to there were 5 out of 6 of the classes, and they used their vouchers at the farmers market, and they both have moved closer to their one moved closer to a weight loss goal, and one moved their hemoglobin A1C down by zero point 0.3 points, much closer to 6 than they were. They started off at 6.7 and they moved it to 6.4 just in a few weeks' time. So both of those individuals had success. And then another individual who came late to the Produce Plus program. And again, in order to participate, she had to be enrolled in a class. And her challenge was obesity. And she came late to enroll in the Produce Plus program and basically, please let me participate in this program, because she had missed the deadline. And so I, got a special, request into DC Greens, and they said, of course, yes, she can participate. And she also came to at least 5 out of the 6 diabetes self-management classes and highly rated the experience, and also moved closer to her weight loss goal.
Well, Dr. Clarke, clearly the collaboration that you've had with the QIO has been effective and is making changes in your patient community. And that's good for us to hear. It's music to our ears. And we just want to personally thank you for all the hard work and commitment that you're doing to change the lives of DC residents. And so, again, thank you for sharing your time. I guess my last question would be, for those providers or your colleagues who may not be working with the QIN QIO, what would you suggest for them?
Well, I would suggest really tapping into the resources that are available. If you're interested in extending your impact and interaction engagement with your patient beyond just the 15 minutes that you spend with them, there are other resources that you could tap into via the QIO to really understand how to do that better. I should also mention one other piece, and that's the reports on the adverse drug events that we have. We were able to use that data to enter it into a grant that we applied for medication therapy management in our practice, and we're using that data to start off as a baseline to see if we're able to improve that rate through our medication therapy management program. So in addition to the programs that Delmarva can assist you with, they can also provide data regarding your practice and how you're doing, so that you can benchmark yourself on improvements that you're interested in making.
Wow, fantastic. Again, thank you again for coming out and for sharing your story. We look forward for continued collaboration moving forward. Thank you again.
Looking forward to it as well. Thank you.
All right.